It's normal as a man gets older that the prostate will naturally increase in size.
Yes. And it's normal, although not pleasant, for a man as he gets older to have problems with urination. Because
Yeah.
as the prostate grows, think of it as a donut. And the hole in the donut is where you urinate.
Mhm.
And as the prostate grows and you're urinating here, it's doing this. And when you put your finger in the rectum, you're feeling this. The only way to know what's going on here specifically is to look with a cystoscope in the urethra, with an instrument in the office. But feeling it on the outside is an indirect way of assessing what's going on the inside.
If it's closing, why would that lead to more frequent urination?
Because it causes irritation of the bladder. The bladder's pushing harder to get the
Okay.
urine through that hole. And the
Okay.
more it pushes, the more irritated the bladder gets. So if you look at the bladder through the urethra, through the hole in the penis and the lining of the penis with a scope that visualizes the inside of the bladder, what you see normally is a very smooth bladder, kind of like the inside of a balloon, maybe. But
Mhm.
then as it pushes and pushes, muscle bundles start coming up in the bladder. It's called trabeculation. And when you look into the bladder with a cystoscope, you can actually see these enlarged muscle bundles, which tells us that that bladder is pushing. And then the more it pushes, the areas between the muscle bundles actually start thinning out and form little outpouching called diverticuli. So you can actually see the muscle bundles and then the little craters between them. And that's a deteriorating bladder. And it can get so bad where it doesn't work anymore. So we see not infrequently patients whose bladder has totally decompensated from years of pushing and getting no type of therapy.